Hello guys, welcome back. So the today's topic is development of interventricular septum. So let's try to make it concise, easy and understandable way. Okay. So let's start with the origin of the interventricular septum. It begins around fourth week of gestation. It begins around week 4 of gestation, and it forms from the floor of primitive ventricular chamber. It forms from the floor of primitive ventricular chamber. Floor of primitive ventricular chamber here. Specifically, the junction between the primitive left and right ventricles. Between left and right ventricles. This is left ventricle. This is right ventricle, and this is left ventricle. This is a endocardial cushion. And there are two components. The interventricular septum has two main components that develop in different ways. First one is muscular part and the second one is membranous part. So let's talk about the muscular part. Muscular part arises from ventricular myocardium. Muscular part arises from ventricular myocardium from here. This is ventricular myocardium. From here muscular part arises, and it develops as a crescent shaped ridge that grows upward like this, that grows upward from the apex of the heart. Okay, so muscular part arises from ventricular myocardium, and it is develops as a crescent shaped ridge that grow upwards from the apex of the heart, and that means this is the apex of the heart. From here it will grow like this, and initially it does not reach the endocardial cushion. From here to here it does not reach the endocardial cushion, leaving a temporary opening called interventricular foramen. This space is interventricular foramen. It leaving a temporary opening called interventricular foramen. And the next one is membranous part. So membranous part, it forms later and is derived from the three structures. What are the three structures? Membranous part is derived from endocardial cushion. Number one is endocardial cushion, which contribute to connective tissue. And the second one is the right bulbar ridge. Third one is left bulbar ridge. So two bulbar ridges and endocardial cushion. These three combine to form this membranous part. So the membranous part closes the interventricular foramen. Generally, what this membranous part will do, it will closes this interventricular foramen. Then what happens? Then fusion happens. So by week 7 to 8, the muscular and the membranous parts of interventricular septum fuse. This will fuse at week 7 to 8. This will fuse. Who is going to fuse? This muscular part stopped growing till here, but membranous part will grow until here, closes this interventricular foramen. So the fusion process is coordinated with the formation of aorticopulmonary septum, ensuring proper alignment of the ventricles with their respective outflow tracts like aorta and pulmonary trunk. And the clinical correlation of this, that is ventricular septal defect. So again I'm saying fusion and closure. This will fuse by week 7 to 8. Muscular and membranous parts fuse, okay, closing the interventricular foramen and ventricles fully separated. And this fusion also connects the aorticopulmonary septum. Which ensures aorta and pulmonary trunk are correctly aligned with their respective ventricles. So failure of proper fusion can result in ventricular septal defect, and this can be membranous and muscular also. If it is membranous ventricular septal defect, that is 70 to 80%, which is most common, and the other one is muscular ventricular septal defect, which is 20 to 30% only seen in. And this is failure of proper fusion can result in a ventricular septal defect, and it can lead to abnormal blood flow between the ventricles. It can lead to abnormal blood flow between the ventricles. So I'll tell you a mnemonic to remember these key steps. So my mnemonic is, I'm writing here. So my mnemonic is my bulky endocardial heart. So this is my bulky endocardial heart. So what the mnemonic is, my, that is muscular part forms first. Okay, then bulky. What bulky is? Bulbar ridges contribute to membranous part, and endocardial is endocardial cushion complete the septum. And finally, heart. What it says, final structure is fully separated left and right ventricle. Separated left ventricle and right ventricle. So see, that is my bulky endocardial heart. That is my for muscular part forms first. You see here, this muscular part forms first. This muscular part forms first. And the bulky is bulbar ridges contribute to the formation of the membranous part. And endocardial cushion complete the septum. You see here, this stopped growing till here, muscular part, but the endocardial cushion grow from here to here, closing this interventricular foramen. All right. So the heart. So finally, left ventricle and right ventricle separated finally. This is development of the interventricular septum. Thank you. Like this, you can remember the interventricular septum.